Let me ask you, things that are important to the insurance company. What are they looking for? What are they trying to get from me?
Look, they're trying to find from you that you didn't go to the doctor, you didn't go back to the doctor, you didn't regularly go to the doctor, you didn't follow your prescriptions, and sometimes doctors prescribe physical therapy, especially if you have a cervical and neck injury, a lumbar, low back injury, or a thoracic, mid-back injury. They prescribe physical therapy. What the insurance company would like to see happen is that, let's say, for example, you were prescribed 12 sessions of physical therapy. What they want to see is that you're not a compliant patient. You don't follow the doctor's orders. You don't show up for physical therapy. You no-show to four sessions, or 6, or 2, and they're going to use this against you. They also look to see if you have gaps in your medical treatment, meaning you go to the doctor, maybe the emergency room, maybe you go to the doctor the next day, maybe they go to the doctor in 10 days, but you don't go back for months, weeks or months. They're looking for that. And some people say, I'm just gonna suck it up. I don't want to go to the doctor. I'm hurt. But if you don't go to the doctor legitimately and report all your symptoms, how it has affected you, how it affects your life, then they're going to use it against you, and it's going to hurt you in the long run.
How about the property damage? Are they concerned about that?
Of course they are. These insurance companies love to handle what they call MIST cases. MIST, M-I-S-T, stands for minor impact soft tissue injury cases. They think they've got you beat right from the very beginning if it's a missed case. Not necessarily true. You need to know how to legitimately treat. You need to have doctors that understand muscle injury, nerve injury, bone injury, disc disruptions, herniated discs. You need to have attorneys that understand the medicine, like radiculopathy, stenosis, degenerative disc disease. You need to have attorneys that know the mechanism of the injury and the medicine to maximize your chances, or to even have a chance.
How about medical expenses? Should I keep track of how much I'm spending?
You should keep track of your medical expenses, your mileage, your out-of-pocket expenses, and if you don't have health insurance, as we've discussed, if you don't have med pay, there's a way to get it done on a lien basis, and you can keep track of your medical expenses that way. Insurance companies really, really want you to go to the doctor maybe once or none, not at all, and then forget it. And if you're legitimately hurt, that's the last thing that you should do.
You know, quite often I hear the term mechanism of injury. What's meant by that?
So critical, and let's take a car crash collision case, a mechanism of injury. Where you rear-ended, usually your cervical part of your spine with your head, it moves back and forth rapidly. Rapid acceleration, rapid deceleration affects the nerves, the muscles, the discs, and causes disc disruption. And that causes injury. The other part of your back, the low back, the lumbar at L5-S1 level, that usually is injured first because your seat usually in a rear ender hits you. So you must know the mechanism of injury, meaning exactly how the injury occurred when you were impacted. Sometimes you hit your head on the windshield. Sometimes you hit your head on the steering wheel. You need to know that to prove how you were injured and what it means to you medically.
Well, this goes back to what we've talked about before. I get a sore back from an accident, or I get a sore back from falling, and I don't go do anything for a couple of days or for a couple of weeks because I think it's going to go away. I go to my hot tub, I get a sauna, or I get a massage. What happens when I haven't gone to somebody and then I find out I do have a significant injury or some kind of injury caused by the trauma in the incident or accident?
Right. If you don't seek medical treatment in a reasonable time limit, it's going to hurt your claim and sometimes defeat your claim. Therefore, you must go to the doctor. You must go to the healthcare providers. It can be a chiropractor. It can be a medical doctor. It can be a doctor of osteopathy. It can be acupuncture. It can be all of those. It can be a physical therapist. But you must seek medical treatment on a timely basis or your claim is going to be compromised.
When I go, do I want them to take x-rays? Do I want them to do an MRI? What do I want?
You know, you really do. X-rays, the resolution of those tests don't show much. ER doctors do them to see if you've compromised your spinal cord or your spinal canal. Then they release you with usually pain medication and muscle relaxants. But if you follow up treatment, then the doctors get into MRIs. The resolution of those tests is finer. They can see more on an MRI. They can do more on a CT scan. They can do more on an EMG. The point of the matter is the doctors have to go to take care of you. You have to go to the doctors, and you need lawyers that understand these things.
Do I want to do this even if I have just muscle injury or soft tissue injury?
Right, and most doctors I've learned over the years that they are trained to understand that most things initially they assume are muscle related. Sometimes your nerves are compromised. Sometimes you have conditions like chemical radiculopathy. Sometimes you don't have any movement of the disc, but you have injuries to the nerves. Sometimes you have radiating pain down your arms, your hands, your fingers. Sometimes they tingle, they go numb. It comes and goes. It's like your arm going to sleep. Then it comes back. Same thing with your legs. And the nerves come from your disc. And then you can prove the injury, and you can prove exactly how it's going to compromise your life.
What are the areas that I can recover from in an injury, a trauma-related injury?
Right. You know, you have to understand how it's going to affect your work life. Some people can go back to work, some people can't. Some can only work part-time. You have to know medically how it's going to affect your day-to-day living activities, your recreational activities, your at-home activities. You can recover for your medical bills even though they might have been paid for by another source like MedPay. You can recover even though they might have been paid for by health insurance. You can recover for lost wages, medical bills, pain and suffering, physical injuries, loss of quality of life, or sometimes called loss of ability to enjoy life. These are categories of damages you need to know about. And we don't have time in this virtual injury seminar to explain in detail how you legitimately prove each one of these categories of damages, but you have to do it.
How about futures?
One of the most important things that you can think about or know about are future damages. Meaning, in other words, if you're injured today, you're still treating in 4 months, you're still treating in a year. Questions. Are these conditions going to be with you in 10 years, 5 years, the rest of your life? Are you going to need surgery in 3 years? Are you going to need surgery in 7 years, 8 years, 15 years? If you need surgery, is there going to be a revision surgery? And if you need surgery, what are the risks associated with the surgery? You need to know those things, and your attorney needs to know them so they can help you. These have to be presented to the insurance company for the at-fault party.